Hi, welcome back to Pool Ahmed. Today's topic is frostbite. Frostbite is a freezing injury. There will be phases, like one is pre-freeze. In pre-freeze, there will be vasoconstriction as well as ischemia, but ice crystal formation will not be there. The person can complain of hyperesthesias or paresthesias of the limb. Proper intervention is done here, then there won't be any permanent damage. Next is pre-thaw. In this, we are going to have ice crystal formation. Then comes vascular stasis. Later, late ischemic phase. Frostbite is a thermal burn, so we can classify them into degrees. First degree is numbness and erythema. Second degree is vesiculation. Third degree is hemorrhagic blister formation. Fourth degree is necrosis, which is involving up to muscle and bone. Then comes Kochi classification. It divides frostbite into 5 grades based on the discoloration. So let us see here. Grade 0 is no discoloration, whereas grade 1 is involvement of proximal phalanx. Grade 2 is middle phalanx. Grade 3 is distal phalanx. Grade 4 is metacarpal bones. In foot we say metatarsals. And grade 5 is carpal bones. Then in foot we say tarsals. And grade 2 is involvement of thumb. Grade 2 involvement is also considered as grade 2. So in grade 2, what we are going to do is we are going to go with the iloprost, that is prostacyclin agonist, which causes vasodilation. Whereas grade 3 and 4, they are candidates for thrombolytic therapy, and grade 5 likely to go into amputation. Then comes primary prevention. Cold induced numbness is a warning signal. Initially, that is going to be numb. Later on, it will resolve. But you shouldn't think that since it is resolved, I am out of danger. No, there is damage already started and it's going on. So initially, when you get numbness only, you are supposed to take measure. You are not supposed to wait because you are supposed to cover whatever exposed areas are there, but never too tightly. Do not use tight cuffs. Do not use tight shoes. And strictly no to alcohol as well as drugs. Just like in hypothermia, which we discussed, alcohol is going to impair the judgment, so drugs. Coming to secondary prevention, do not thaw if you cannot maintain it. Give low molecular weight Dextron that will reduce the viscosity of the blood, ensure adequate hydration. Give COX inhibitor, which is ibuprofen. What this does is it will ensure that thromboxane levels come down as well as it will inhibit harmful prostaglandins. Limit the mobility. You do not want the person's leg to be further damaged. If thawing can be achieved and maintained till the hospital is reached, go ahead, take a warm water bath, ensure that temperature is always 98.6 degrees Fahrenheit to 102.2 degrees Fahrenheit. You're supposed to maintain this range. The limb should be placed when the water is circulated so that the limb temperature will get uniformly distributed and limb becomes warmer. And once warming happens, then with complete thawing, the limb will become red or purple, easily bent and soft. This is a sign of complete thawing. Povidone iodine or chlorhexidine antiseptic solution can be added into the water. Do not drain hemorrhagic blisters, drain only clear blisters. And once the limb is out, make sure you air dry or blot it. Do not rub it. We don't want any additional trauma. You can apply aloe vera gel to the limb. If thawing is not feasible out of the hospital, once the person enters hospital, anyway thawing is done. And once it is achieved and like I said, aloe vera application is done, they can go with bulky dressing material. They can do the bulky dressing of the limb and then elevate the limb. Ensure that oxygen is given only if SpO2 falls to less than 88%. Tetanus prophylaxis is a must, as well as the person can eventually go into hydrotherapy. And in last resort, when everything fails, then we do amputation. If you liked the video, do give a like, share as well as comment. Do not forget to subscribe Pula Med. We'll be posting more videos on important questions as well. Thank you.